Hello everyone and welcome to Module 4. This week we are focusing on women's health. So that is going to be focused on two chapters. That is going to be chapter 33, pages 705 to 721, and chapter 38, pages 858 to 873. So these can be pretty intensive and deep chapters, so we're going to go ahead and jump in, but know that because we're talking about the women's health, we're talking about the reproductive system for females, as well as some urinary specialist things here. So let's start with chapter 33. So 33 is focused on the female's reproductive system, which primarily consists of the sex organs, the ovaries, and some accessory sex organs such as the uterus, fallopian tubes, vagina, vulva, and breasts. So let's take a look at each of those a little bit more so you can have a better understanding of each part of them. So when we talk about the ovaries, each woman has two ovaries within their female reproductive system. They're located on either side of the uterus, and they look very similar to an almond. Now, ovaries have two functions. They produce an ova, or an egg, but they also produce the female sex hormones. The uterus is a hollow-shaped organ that looks very similar to a pear, and it is located in the front of the pelvic cavity above the bladder. Your uterus has three main functions. Once a month, it's going to go through menstruation, or the discharge of blood. It provides nourishment and protection for a fetus during pregnancy, and during labor it helps to contract to birth the baby. The fallopian tubes are two tubes, one on each side, that extend from the uterus. They extend from the uterus and bend inward towards your ovaries. The main function of the fallopian tube is to move the egg from the ovary to the uterus, and each tube is roughly about 4.5 inches long and only 1/4 inch wide. The vagina is a tube that is composed of muscle and membranes. It extends from the uterus and is typically about 4 to 6 inches long. Now, the vagina has three main functions as well. It is the organ for female copulation. It's a passageway for discharge during menstruation, and the passageway of a baby from birth. Next, we have sort of the external genitalia. So everything we just talked about, the ovaries, uterus, fallopian tube, vagina, those are all internal female reproductive system organs. The vulva and breasts are the external components of the female genitalia. The vulva is actually made up of 5 different organs. It's the mons pubis, labia majora, labia minora, vestibule, and clitoris. And the breasts are 2 round-shaped structures composed of fatty tissue that protrude from the chest. Each breast has a numerous amount of glands that form 12 to 15 tissue lobes. The areola is the dark pigmented circle of the skin found on each breast. And then from the middle of the areola, you have the nipple that extends outward. So that's kind of a rough overview of what chapter 33 is. That's talking about, obviously, the female reproductive system in and of itself and the different sex organs. I would tell you, I would still read through that just to make sure that you're getting all of the information. While I do a great job of kind of doing a rough overview, I don't go through everything, obviously. Let's move on to chapter 38, which is talking about gynecology. And gynecology is the branch of medicine that deals with disorders and diseases of the female reproductive system. An exam of the female reproductive system will include both a breast exam and a pelvic exam. The breast exam will help to detect any sort of breast cancer. Patients will lie on their backs with their hands above one hand behind their head, allowing the physician to look at and examine the lymph nodes. It is suggested that patients perform a breast self-exam starting around age 20, but we can also start that for ourselves in the clinic around age 20 with their female pap smear exam. They should be doing their breast self-exams at home once a month, about 1 week after the menstrual cycle ends. All right, so let's go ahead and talk about the menstrual cycle itself. So this is actually a pretty intense thing to talk about because it's never easy to talk about the menstrual cycle. But what we need to know is a typical menstrual cycle is somewhere between 28 to 35 days. So typically about 1 month. And it has 4 phases that it will go through. The first one that everyone pretty much knows is what we call the menstrual or menstruation cycle. This is where you actually have that period. And it will start around day 1 and last about 4 to 6 days. Next will come your follicular phase, which is where your uterus will start to thicken, and it takes place on about the 5th day of the cycle. So towards the end of your period, this is when that follicular phase starts in, and it's going to last until about day 14. From there, what happens is we have ovulation, and that is when your egg is released. And that's about until day 21, so about a 7-day period. We need the follicular phase to happen to kind of beef up the endometrium, so that way the egg has something to actually attach itself to once it does become impregnated. And finally, we have what we call the luteal phase, which is where your progesterone levels are at its highest. And typically that's going to happen obviously after the ovulation phase, because if you have become impregnated, the egg itself will need nutrients, and that comes from your progesterone levels. We kind of already talked about the breast exam as well, but here's just some other key information for you, especially that top one there. We're about 12.4% of women in the United States at some point in time in their life will develop breast cancer. So as a medical assistant, it's really important that we encourage our patients to make sure they're doing their breast exams, whether that be a mammogram once they start at age 40. Typically that's when we do start them, but if the patient has any sort of family history with relatives that are blood related, specifically moms, grandmothers, aunts, cousins, we typically tell you if you have any sort of family history, you want to start before that because you do want to catch it early. Your clinical breast exams, like I talked about earlier, those start about your 20s, and they're part of your yearly physical pap smear exam. And then the self-breast exam, again, should be started by all women in their 20s, and again, completing this once a month, about 1 week after their cycle ends. I typically tell my patients that they want to do this either in the shower or lying on a flat surface, just because then especially in the shower, you're warmed up, and it will help if there is anything, it will actually bring it to the surface more. All right, let's talk about the pap smear and the cervical cancer screening. A pap smear is both internal and external, and is part of every pelvic exam that a provider will do. Generally, we call the internal exam a pap smear, and it helps to diagnose cervical cancer. What we're looking for mostly is either the cervical cancer or certain types of sexually transmitted diseases, or STDs. The human papillomavirus is actually the most severe and most common cause of cervical cancer. It's a group of more than 100 different viruses, and in the United States, about 10,000 women are diagnosed with cervical cancer every year. It used to be a study that we had to have pap smears, or they would tell women they had to have pap smears every year But new studies have come out that says if a patient has had a normal pap smear exam, that they can go 3 years before their next one. But again, if you have a family history of cervical cancer or any sort of cervical problems, endometriosis, polycystic ovarian syndrome, you want to make sure that you're still having that every year. Now, if, however, a patient has an abnormal pap smear, the provider will perform a procedure called a colposcopy, which is where they will actually visualize the vaginal and cervical tissues and take a biopsy for later testing. Another part of gynecology is dealing with prenatal care, especially when we have moms who are pregnant. We want to make sure that we're taking care of them. So prenatal care actually comes for pregnant women prior to childbirth. It's a way for us to teach them how to have a healthy lifestyle during their pregnancy and reduce risks of any potential problems for not only themselves, but for the unborn child. We want to especially tell our mothers as they're pregnant, they want to avoid smoking, drinking alcohol, and taking certain medications. Now, we know that there are some medications that they have to take on a regular basis to help maintain themselves. So always encourage your patients, if they are taking any medications and they become pregnant, they need to tell their provider right away, so that way we can get the best care possible. The last thing that we like to do in prenatal care is determine what we call an estimated delivery date. And in order to do this, we use what we call Nagel's rule. And you can see the formula there is the last menstrual period plus 7 days minus 3 months plus 1 year will give you the estimated delivery date. I know that you'll be working a little bit more with that in your lab classes this week, so be looking forward to that. All right, guys, that is all that I have in regards to chapters 33 and 38. As always, I'm going to put my little tidbit in here. Please make sure that you read those chapter pages fully. They will help you with the discussion board for this week, as well as helping you with the quiz and your lab classes. So for this week, you do have one discussion board. That initial discussion post will be due on Tuesday, July 25th by midnight. And your discussion board this week is looking at age as it relates to the female reproductive system. So you'll want to discuss, does age really matter when it comes to the female reproductive system? Why is conception after a certain age considered more high risk? Now, you'll get some of this information from your book, but I would tell you, you really do need to research this and to get a good grasp of why that is so important. You will need to make sure it's completed in APA format with a reference page. And again, your initial post is due July 25th, which is Tuesday by midnight. You do have one quiz this week, which is over those 2 chapters, and it is 10 questions, all multiple choice, and you have a 10-minute time limit. That will be due no later than Sunday, July 30th by midnight. All right, guys, that's all I have for you this week. If you have any questions, comments, or concerns, please make sure that you are reaching out to me either via the course messaging in Blackboard, or you're giving me a call at my direct line on campus, which you can find on your course homepage at the top right by my picture. Have a wonderful Module 4, guys, and I'll talk to you in a week. Bye-bye.